So, so good morning. Thank you to Megan Cummings from the Rappahannock Rapidan Health District for being here to give us an update on vaccinations for older adults. So, Megan, thanks for being here, and I will turn it over to you.
Okay, sounds good. Well, hello, everybody. My name is Megan Cummins. I am with the Rappahannock Rapidan Health District, and I am the Health Equity Specialist. So I'm excited to talk to you about vaccines in older adults. So let's go ahead and get started. Okay, so an overview of vaccines. They were created to protect against infectious illness. They can provide extra protection for specific age groups to include older adults, immune-compromised individuals, and babies and children that are too young to be vaccinated. They are created to prevent illness and death, and then most are covered by Medicare and also private insurance. Okay, so this is just a good picture reminding everybody that vaccines are essential for all age groups. As you can tell, there's guidelines for young children, also regular adults, and then if you're getting into the older age groups. So the Alliance for Powerful Change notes that vaccines prevent deadly diseases. Annually, an average of 49,000 people die from the flu and its complications. The majority are among adults, and that's from the CDC. Vaccines prevent hospital stays. An average of 226,000 people are hospitalized due to the flu each year, also by the CDC. So the total economic cost of treating adults who have vaccine preventable diseases is estimated to exceed $10 billion a year, and that's by the WHO, so the World Health Organization. And then 2 to 3 million lives are saved, as it's one of the most effective health interventions, saving millions of lives each year, and that's from the World Health Organization. So currently we have a little bit of more work to do. So only 3 out of 5 adults have been vaccinated, while the Healthy People 2020 aims to have 90% of adults over 65 vaccinated for the flu. So here is just a graph showing how helpful vaccines have been. So this is the crude death rate for infectious diseases, and that's going back to 1900 through 2020. So as you can see at the beginning of this graph, that's where 40 of the states have an established health department. We have been trending down until we hit the influenza pandemic, and that actually jumped up 70%. So that's a 70% rise in cases, or rise, in the death rate from infectious diseases. And then after that pandemic, we slowly are making more progress. Then you can see the first use of penicillin. So that's a huge public health advantage for the public. And then here's where the Salk vaccine was introduced. And then, as you can see, the passage of the Vaccination Assistance Act, which made it more accessible for more adults. And then you can see how we're trending down. And then, unfortunately, due to the pandemic, we've had a sharp increase in the death rate from infectious disease. Okay, so which vaccines are recommended for older adults? So we have a couple of them. So we have, this year, we have the updated COVID-19 vaccines. We have the flu vaccine, influenza. We have the RSV vaccine. We have the pneumococcal, so that's for pneumonia, shingles vaccine, Tdap or TD, and then others, which are based on individual and specific need. So the 3 that are starred on here, so this is the first fall and winter virus season, where vaccines are available for the 3 viruses most responsible for hospitalizations. And right now, the standard of practice is to co-administer vaccines at the same time. So you don't need a specific time interval between receiving them. So some of the vaccines may have an interval between you can get the next the same vaccine multiple times, but you can get the COVID vaccine, the flu, and the RSV vaccine at the same time if you want to. So that is to make it more accessible to more people and make it so you don't have to come back for another appointment. They have studied it, and it's safe to do that. They wouldn't recommend people to get multiple vaccines at the same time if it wasn't proven to be safe. And then, as always, others are needed for specific reasons, such as travel. If you're going internationally, you might have to get them at a pharmacy rather than coming to the health department. But if you have certain health conditions, that might make you more likely to consult with your doctor and see if there's any additional vaccines that you might be eligible for. So oops. There we go. All right, so for the COVID vaccines, and those are for the 2023 to 2024 season. So every adult should receive 1 dose of the 2023 to 2024 Pfizer or Moderna vaccine. So every adult should get that if it's been at least 2 months since your last dose of any COVID vaccine. So at this current time, there's no additional dose recommended for, so you're only supposed to get 1 vaccine this current season. So you don't need a booster. So there's not going to be 2 vaccines during this current season, and that's for the general public. Obviously, if you're immunocompromised, you may be eligible for additional doses, and that would be consulted by your healthcare professional. And ages 65 and older are still the priority to be vaccinated. So you want to make sure if you're eligible and if you're considering, we definitely want you to get that updated vaccine for this current year. So these vaccines are targeting the XBB lineage of the Omicron variant. So that is anticipated to be better at protecting against current strains of the Omicron variant that are circulating. So again, current guideline is for all adults, regardless of immune status, should be getting a vaccine now if it's been at least 2 months or longer since your last vaccine. So reasons to get your vaccine. So according to the CDC, more than 81% of COVID-19 deaths occur in people age 65 and older. So the number of deaths among people age 65 and older is 97 times higher than the number of deaths among people ages 18 to 29 years old. So a person's risk of severe illness from COVID-19 increases as the number of underlying medical conditions they have increases. And getting vaccinated is one of the best things you can do to prevent hospitalization and death due to COVID. So just like in other seasons or in other years, masking, washing your hands, keeping a safe distance from others, staying home when you're sick, all work together to lower your risk of illness and death. Okay, so COVID-19 vaccines this year are covered by insurance. In previous years, they were free, provided by the government, but this year they are covered by insurance. So you can visit vaccines.gov to find a convenient location. You can check with your insurance provider and or the vaccination site to confirm that the site is in network. Depending on your plan, you may have a copay if you try to get your vaccine at a site that's outside of your current network. If you don't have insurance, the CDC's Bridge Access Program offers COVID vaccines at no cost for adults 18 years and older without health insurance, and adults whose health insurance, does not provide zero cost coverage for the COVID vaccines. And I checked this morning, but if you, we can follow this link in a little bit, but I checked and there are probably 5 locations here in Culpeper that have the COVID vaccine. And when you look, you can see which vaccine is available, like you could in previous years, but also if the program does participate in the Bridge Access Program. So our health department will be offering a Bridge Access COVID program by appointment at the health department. So the vaccine is anticipated to arrive soon. It has not come in yet. We will be offering vaccine appointments for COVID by calling the health department once the vaccine arrives. We will let you know on our website, but also our Facebook page to know when they can start scheduling. So keep a lookout for that. That'll also be in our newsletter whenever it comes out and it's available for the public to make appointments at our facility. Okay, so now we're getting to the influenza. So all adults should be getting the annual flu vaccine. Adults 65 and older should be getting the high dose adjuvanted flu vaccine. This is a new change, but persons with egg allergy, you should receive the influenza vaccine. It's no longer a contraindication to getting that. And we encourage you to talk to your healthcare professional to see which option is best for you. And as a reminder, treatment is recommended as soon as possible for any patient with suspected or confirmed influenza. And just so you know, adjuvanted is just an ingredient in the vaccine that helps create a strong immune system response to the vaccine. That little ingredient, the adjuvanted ingredient, is egg-based. But like I said, egg allergies are no longer a contraindication for getting the vaccine. Again, we encourage you to discuss your allergy concerns with your healthcare professional, as you would anytime you are getting a vaccine. So the flu vaccine is recommended by the CDC to be given through September and to the end of October for best coverage for the flu season. It is still okay for you to receive the flu vaccine from November through the spring if you were not able to get it during that prime time. So from September to October. The flu vaccine is needed yearly, so think of it as a booster from your original vaccine to help you stay healthy. And we want to remind you that the best protection is to be vaccinated prior to exposure to the flu illness in the community. So that's why we want you to get it before the flu season really takes off. Excuse me. All right. So now we have an RSV vaccine. So since June of 2023, ACIP has recommended the first 2 RSV vaccines for adults over 60 using shared clinical decision making. So that's Arexvy by GlaxoSmithKline and then Abrysvo by Pfizer. So both of these vaccines are a single dose. They are generally well tolerated and safe. So they have similar side effects to those that you would expect from any vaccine. So that would be pain at injection site, fatigue, headache, muscle ache, and or joint pain. So at the health department, we are not providing this vaccine. The vaccine is approved for pharmacy coverage under Medicare, and Medicare will cover this vaccine at 100% if you have a pharmacy administer it. Most major insurances, if you have private insurance, are also covering this vaccine if it's administered at a pharmacy. Okay, going into pneumococcal for pneumonia. So there's a couple different vaccines for pneumococcal. So adults 65 and older can get Vaxneuvance, Prevnar 20, and Pneumovax 23. So Pneumovax 23 is recommended every 5 to 10 years until age 65. Once one dose is given after you turn 65, the vaccine series is complete. So Vaxneuvance or PCV15, if you look at like the CDC's website, it lists all the vaccines individually. So Vaxneuvance or Prevnar PCV13 or PCV 20 is given once over the age of 50. It must have at least a year time span between Pneumovax 23 and the PCV vaccine choice is for best coverage and for insurance to cover the cost. So you have to follow the specific series for the vaccine to be covered 100% by your insurance. So again, based on your age and your health status, it's best to consult your provider to see which vaccine is best for you. And Medicare Part B covers 100% of the cost of the 2 different pneumococcal vaccines for ages 65 and older. Okay, so now we're moving on into shingles. So 1 out of every 3 people in the US will develop shingles in their lifetime. If you've ever had chickenpox, you can get shingles. And as you age, the risk of shingles increases. I would say that you don't have to be over 60 or 50 to get shingles, but your your age is certainly a factor for making you more likely to get shingles, as is your stress, as is your sleep quality. So again, there's a lot of different factors affecting your risk of getting shingles. So the CDC recommends 2 doses of recombinant zoster vaccine. So that's RZV or Shingrix in those 50 and older. And those vaccines are given at least 2 to 6 months apart. And they are covered by Medicare Part D for no out-of-pocket expense as of this current year. So if you ever had chickenpox or you were vaccinated for chickenpox, you can get shingles later on in your life. Excuse me. Sorry. So Medicare Part B covers shingles at a pharmacy. A person requesting the shingles vaccine with Medicare is referred to pharmacy, as they could be responsible for costs at a primary care or health department due to the vaccine not being covered on the pharmacy plan for your Medicare. So if you have any questions, it's best to talk to your healthcare team as well as your insurance to see what is the best option for what is covered for your specific plan. So there's other vaccines. So TD or Tdap is for tetanus, diphtheria, and pertussis. So those are recommended as a booster series once every 10 years, or it's once every 5 years if you have a particularly dirty wound or a burn. If you have grandchildren or great-grandchildren, it's recommended that you stay up to date for your Tdap. So that would be the tetanus, diphtheria, and pertussis vaccine, just to make sure that you're not a carrier or spreading pertussis or whooping cough to the infant before they can get their vaccines. So other situations where vaccines may be recommended for you is if you're traveling internationally, specifically for cholera, polio, yellow fever. There's plenty of different ones, hepatitis. But again, it'll be recommended for you to have vaccines based on which country and which area you're going to. And as always, specific health conditions and concerns can make you eligible for more vaccines. So unfortunately, we at the health department don't have a travel clinic. However, you can get them with your primary care provider, or call your insurance plan to see where you can receive those other vaccines. Okay, so now we're going into Virginia COVID-19 trends. This is for the past 6 months. So as you can see, 2% of emergency department visits were diagnosed for COVID in the week ending, and that's September 23rd. So 6.8 points lower than the previous week ending. So we had a slight surge in August to the early September period. And then you can see the 4-week trend in COVID diagnoses and ED visits. So we're on the right trend. So we will see how that goes as people start congregating indoors more, as the weather cools off and as the virus tends to spread. Okay, so now we have respiratory virus, so that's RSV activity in Virginia. So our numbers are slightly high for COVID, and then you can see the flu and RSV are different lines. And then the combined line would be the black one. So not terrible, but obviously they are still spreading in the community. So we want to make sure that you have all the protection that you are eligible for. Okay, and then now we're going into COVID cases. So that's through the end of September. So, and this is for the whole state, but as you can see, our health districts, so Fauquier County, Rappahannock, Orange, Madison, and Culpeper here in the middle. Okay, and then this is just a quick chart. Again, these are the ones that are geared towards older adults. So the updated COVID vaccines, this is for, well, the age recommendation is for everyone 6 months and older, but again, 65 and older should be getting the updated COVID-19 vaccines. The same with the flu. All adults should be getting the flu vaccine. And if you're interested, you can get the RSV vaccine if you're 60 and older. So for pneumonia, it varies based on your health conditions. And again, if you in your vaccination series previously, shingles, if you're 50 and older, you can get that vaccine. And then as a reminder, excuse me, Tdap is a booster every 10 years. And that's all I have. I will hand it back over to you, Anna, and then I can take questions.
Wonderful. Thank you so much, Megan. Great information. So we'll just open up the floor and see who may have follow-up questions for Megan. You just go ahead and yeah, go ahead.
Megan, this is Lola Walker. I work at Encompass Community Supports, and I supervise 5 senior centers. I was just wondering if there are any COVID vaccine kits available through the health department that we could keep on site in case any of our seniors may need them.
I can't hear if I think the phone or the connection dropped out.
Oh, yeah, she was just asking if there are COVID test kits available. Lola works with Encompass Community Supports and oversees the 5 senior centers in our district. And she was asking if there are COVID kits available from Department of Health that they could keep on site for testing.
Oh, okay. I'm sorry. I thought she was asking for vaccines to keep on site.
Oh, no.
That's what I thought. I was like, oh, I'm sorry. I was like, that's a
no, thank you.
We don't normally get that request. I believe we have a limited supply, but I did want to make everyone aware that as of the 25th of September, you can order for more test kits through the post office. So if you go to covidtest.gov, you can put in a request and they will mail you 4 more test kits.
And that's per address, is that correct? Like last year?
Yeah, that's for every household. They do recommend, and this is on the FDA website, and I can send this link when I send the presentation to you, Anna, but the FDA does have a list of which COVID test kits were previously extended for the expiration. So if you have any left over, make sure that they're not extended. They usually do 3 to 6 months maybe at a time for the extended expiration. But if you look on the covidtest.org website, it lists, or it has the link for the FDA site where all the tests are. So you can see if the one that you have may be extended, but it also does let you know that when they ship them, they may ship ones that have been extended. So make sure you're using that FDA website, because you may get one, if you look on the sticker on the actual test, it may say it's expired. However, it's actually been extended they just didn't go through and relabel and re-sticker that, because I'm sure that would be a huge undertaking, as I'm sure they have tons of tests wherever they're coming from. But we do want to let you know that you want to double check your test before you throw it out. But I can get back to you. I believe we have a short supply, so we can try to see if we can have some available to you, Lola.
Okay, thank you.
You're welcome.
And I do want to mention the Department of Health will be at our October 26th Expo. And assuming that COVID vaccinations are in by then, which I think they anticipate, they will be providing COVID vaccinations at that expo as well. So just
And I'm
that.
sure we'll have some test kits too available to the public as well. I don't have information on how many we have, but if we have enough, I'm sure we'll bring a good supply so that people can use them if they need to. I believe if you have Medicare as well, your tests may be covered with the $0 copay, but you want to make sure, I think it depends on your plan. So make sure to check with your insurance to see if you can get some over the counter at the pharmacy.
Great.
Again, I have a question for you. If you have already had shingles, do you still need to get a shingles vaccine?
I believe there's a time limit as to when you can get your vaccine, but I don't specifically know that off the top of my head. That would be a question for Karen, who is our immunization coordinator, or you can always call, your doctor. So unfortunately, I don't have an answer. Don't want to tell you wrong, but I believe there is a time frame, but I'm not exactly sure.
Thank you.
Mm-hmm.
Megan, which of the vaccines can you get together or at the same time?
You can get RSV, COVID, and your flu vaccine at the same time. If that was your question. You can probably get more at the same time, but obviously that would be a conversation that you would have with your healthcare provider. But if you're interested in getting the ones for this current season, then you can get all three at the same time.
Thank you.
Mm-hmm.
Other questions for Megan? Okay.
I have one more.
Yes,
one more
please.
thing. When the health department gets the COVID vaccines in, would it be possible to send out will you be sending that out in your newsletter?
Yes, so it'll definitely be in our newsletter. If you check our Facebook page, we will heavily promote it, and it'll also be listed on our updated website. So I recommend, if you haven't looked at our website recently, we've been working to revamp that. So there's a lot more information on our website that you'll be able to find. So.
Thank you.
Thanks. Any other questions?
Not a question, Anna, but just an announcement. Our group, Low Link, which is a village in Lake of the Woods in Eastern Orange County, will be holding 2 community drive-through vaccine clinics this month on the 14th and the 28th, and information on how to sign up for those will be on our website.
Excellent. Thank you. Well, if there aren't any other questions for Megan, I just want to say thank you very much for being here and sharing with us this important information. And her PowerPoint and the recording will be available on our website at Aging Together, probably in the next 24 to 48 hours. So we're going to stay online, Megan, and we usually do share announcements with each other. You are welcome to stay, or if I know you have a busy schedule, you're welcome to go as well. I'm going to go ahead and end recording as we get into the second part of our meeting. So thank you so much, Megan.
Mm-hmm.